And we know that human milk has protected infants for like as long as the human species has existed. So we were kind of wondering why you think that we only started exploring this kind of recently and haven't really been looking into the capabilities of like our natural bodies instead of relying on more like synthetic medications and things like that.
This is a very good question. I can tell you some thoughts about maybe some of the incentives in the pharmaceutical industry and how that plays into this. Right, I'm no expert, but for a pharmaceutical company, if they can start with a fixed starting material, like a bulk chemical compound, or even like let's say a tree root or something like that, it's kind of easy to price that, to collect it, to produce it, and then to develop it and formulate it into a drug product with a specific price and the formulation and a dosing strategy, all that. That's been very traditional in the pharmaceutical sector. Our approach is very different. And you're right that it is leveraging natural immunity and the fact that polyclonal secretory IgA antibodies are produced by all of us that are, quote unquote, normal or healthy or immunocompetent. We're producing them all the time. And so that happens automatically. But to source them means you have to have humans giving samples. In our case, it's human milk, right? For other companies, it's plasma. So there's a whole plasma biologics industry. And so it introduces all these complexities and nuances of bringing in donors. Are they compensated? So someone has to pay for that. And there's obviously variations from every person to every single other person on the planet, right? Even if they're twins, they're not fully identical. So accounting for all those differences raises significant additional challenges that a traditional manufacturer, let's say aspirin, you're just starting with a bulk chemical and you're pressing it to tablets, and that's a more simplified process with a lot of controls over it. In the plasma biologics world and in the world that we're trying to develop, you would need so many more controls. So there's a lot of complexity. And so there are some practical and logistical reasons why pharma companies haven't jumped on something with this level of complexity.
Talking about incentives for dealing with orphan diseases,